Let's review a case study from 3S Health on improving flow within the Employee Benefits Department. It was important to the Employee Benefits Department to define who their customer was. Who are they serving? They defined their customers as the healthcare employee and their families. They also chose to create a purpose statement, which was, "We take care of the caregivers." They put this purpose statement on their department visibility wall to serve as an anchor to the work that they do. They also felt it was important to have a long-term goal. For them, they wanted to have same-day service. This meant that their customers would be taken care of. The team identified several problems, all related to flow, within their department, including the team members weren't taking their regularly scheduled breaks. There was bottlenecks of certain types of work. Team members experienced frequent interruptions, and there was peaks and valleys in their work, often because of batching of work coming into the department. The team had several data sources readily available to help them learn more about their work. From this data, they learned that the highest volume of phone calls and emails came in on Mondays. And certain processes that had a high turnaround time, like the retirement packages, were received and processed in batches at the beginning of the month. All of this data highlighted the uneven workflow within their department. The team was able to further analyze the data and sort tasks into groups and identified work that fell into one of 4 buckets, based on common steps to each process and the time required to complete each task. Those groups were 5 minutes and under, paper 15 minutes, paper 25 minutes, and chats, resulting in a total of 217 tasks per day. Because they had variable tasks within their work that they do, resulting in various cycle times, they needed to calculate the weighted average cycle time. Shown here in the table, the weighted average cycle time was calculated at 12 minutes. They then calculated the takt time per task. There was 350 minutes available per day and 5 operators, resulting in a total of 1,750 minutes available per day. There was 217 tasks to be done each day, resulting in a takt time of 8.1 minutes per task. Now the team could compare their weighted average cycle time and their takt time. As you can see here, there's a gap between the task takt time and the actual weighted average cycle time, which means, in the current state, the team is not able to meet their demand. To meet the demand, the team had 2 options. One would be to increase the time available by adding more staff. The other is to make improvements to the work and reduce the weighted average cycle time by 33%. Rather than adding more resources, the team decided to see if they could make improvements to the processes and reduce their cycle time. They decided to focus on improving the flow of the retirement packages. The old way was very manual, taking a very time-consuming 25 minutes per package. As the result of several PDCAs, they were able to improve this process by creating an alert for when a new retirement package arrives, and they also automated several processes, including calculations and data pull. After the team tested their ideas and implemented the changes, they had a significant improvement in the weighted average cycle time, as shown here in the graph. The retirements are now part of the tasks that take 5 minutes to complete, and the volume of the 25-minute tasks have been reduced. As you can see, the takt time and weighted average cycle time are much closer to each other than they were when they started this project. The teams plan to continue to find other ways to improve areas of work to help them improve flow even further, with the goal to have the weighted average cycle time below or equal to the takt time. The team had some great results to improve the flow of their work, and they will continue to test ideas to improve this flow even further.